The mammalian cardiovascular system operates under a relentless, cyclical pressure gradient, yet the most perilous period for the human heart does not occur during exertion. As the body enters its 6th and 7th decades, an invisible phenomenon known as hemodynamic sludging begins to dictate the environment within the circulatory system. In the aging demographic, sensory osmoreceptors are heavily blunted, leading to a state of chronic, unperceived dehydration during the long hours of sleep. Without hydration, the blood transitions from a vibrant, thin liquid to a sluggish, molasses-like texture, significantly increasing the mechanical load on the heart. This high hematocrit state means red blood cells and platelets are crammed together, grinding against the delicate arterial walls with every slow pulse. This friction causes physical damage to the endothelial lining, creating a landscape primed for inflammation and catastrophic clotting events. The clinical reality is that the highest incidence of strokes and heart attacks occurs in a window between 4 and 6 in the morning. During this morning surge, circadian rhythms make platelets hyper-sticky, causing them to clump into spontaneous clots within narrowed, sludge-filled arteries. To intercept this threat, consume 16 ounces of water 60 minutes before sleep to preload the system and maintain healthy blood viscosity. This simple act allows fluid to enter the bloodstream, rapidly dilating the hematocrit and reversing the sludging process before you even close your eyes. Supplementing with magnesium glycinate further protects the system, acting as a natural calcium blocker to keep platelets from clumping together overnight. As magnesium soothes the smooth muscle tissue, your arteries relax and expand, removing high-pressure bottlenecks and ensuring smooth systemic circulation. By stabilizing your rhythm and endothelial health, you reclaim biological authority over your cardiovascular system, waking up rested, vibrant, and fully protected. As the hours of sleep progress and the body loses this critical hydration, the fundamental physics of the blood drastically alter. The total volume of blood plasma plummets. When this happens, the concentration of red blood cells and platelets artificially skyrockets. This measurement, the hematocrit level, dictates the blood's thickness. Overnight, it transitions from a highly efficient fluid into a thick, viscous, sludge-like substance. This creates a massive mechanical burden. The heart must pump with significantly greater force to push this sludge through microscopic capillary beds. This friction damages the delicate endothelial lining of the arteries, creating microscopic lesions and tearing the protective layer that normally keeps vascular walls smooth. You are essentially forcing your cardiovascular system to operate with a fluid that has the consistency of molasses during its most vulnerable hours. However, the mechanical thickness of the blood is only half of the nocturnal threat. The other half is governed by the dangerous cyclical biochemistry of the platelets. Platelets are the cells responsible for coagulation, the clumping together to form a blood clot when tissue is damaged. Human physiology operates on a circadian rhythm, and evolutionary biology has programmed our platelet aggregation to peak in the early morning hours, preparing the body to stop potential bleeding during the active hunting and gathering phases of the day. In an aging adult whose blood is already thick and sludging from overnight dehydration, this natural peak in platelet stickiness is biologically catastrophic. The thick blood moves slowly through narrowed, often atherosclerotic arteries, allowing hyper-sticky platelets to bump into each other and adhere to damaged endothelial walls. This creates the perfect, lethal storm for a spontaneous thrombus, a blood clot that forms entirely without an external injury, blocking the flow of oxygen to the brain or heart muscle and triggering a sudden silent stroke or heart attack while the individual is still asleep. To aggressively intercept this nocturnal coagulation cascade and force the blood to remain fluid and frictionless throughout the entire sleep cycle, one must deploy a highly targeted biochemical intervention precisely 60 minutes before retiring to bed. This intervention is not achieved through aggressive pharmaceutical blood thinners, which carry high risks of gastrointestinal hemorrhaging in seniors, but through the precise physiological modulation of blood volume and endothelial signaling using a specific, mineralized aqueous solution. The foundational requirement of this protocol is the simple mechanical restoration of plasma volume through the ingestion of 12 to 16 ounces of room temperature water. By consuming this specific volume exactly 1 hour before sleep, you allow the gastrointestinal tract ample time to absorb the fluid into the systemic circulation, preventing the kidneys from immediately diverting it to the bladder and causing disruptive nocturnal urination. This infusion of fluid directly dilutes the hematocrit, instantly reversing the sludging process and maintaining the blood in a thin, highly mobile state that flows effortlessly through the vascular network, virtually eliminating the mechanical friction against the arterial walls. Yet, simple hydration alone is insufficient to combat the chemical stickiness of the platelets. To transform the water into a potent antithrombotic agent, it must be catalyzed by the addition of a highly bioavailable form of magnesium, such as magnesium glycinate or magnesium taurate. In the realm of cardiovascular biochemistry, magnesium is the ultimate biological antagonist to calcium. When calcium floods into the smooth muscle cells surrounding the arteries, it causes them to violently constrict. When calcium enters the platelets, it commands them to aggregate and form a clot. Magnesium aggressively blocks these calcium channels. By dissolving a therapeutic dose of magnesium into your pre-sleep water, you are flooding your bloodstream with a mineral that actively prevents the platelets from adhering to one another. You are chemically overriding the dangerous early morning circadian spike in coagulation, ensuring that the platelets remain smooth and non-reactive as they navigate the microscopic vessels of the cerebral cortex and the coronary arteries. Liquid protection for a safe and healthy heart. Furthermore, the introduction of this magnesium-rich fluid initiates a secondary, profound rescue mission regarding the muscular architecture of the vascular system itself. The arteries are not rigid, inert pipes. They are muscular tubes lined with smooth muscle tissue that must constantly expand and contract to regulate blood pressure. In older adults, these muscles often become locked in a state of chronic sympathetic constriction, often driven by elevated evening cortisol levels or psychological stress. This constriction creates high-pressure bottlenecks throughout the circulatory system. The magnesium absorbed from the pre-sleep protocol penetrates these smooth muscle cells, forcing them to relax and expand, a process known as vasodilation. As the arterial diameter widens throughout the night, the sheer mechanical pressure required to move the blood drops significantly. You are essentially removing the roadblocks from your cardiovascular highway, allowing the heart to beat with a slow, effortless, parasympathetic rhythm, ensuring that you wake up with a stabilized, normal blood pressure reading rather than the dangerous hypertensive spike that plagues so many seniors. When this highly specific timed hydration protocol is maintained with uncompromising consistency over a 30-day cycle, the internal hemodynamic landscape undergoes a radical transformation. During the first 2 weeks of the protocol, the most immediate clinical observation is a measurable shift in heart rate variability, also known as HRV. This critical biometric marker reflects the essential balance between the sympathetic stress and parasympathetic relaxation nervous systems. As the blood remains thin and the arteries remain dilated overnight, the heart is no longer struggling to overcome viscous resistance. This mechanical relief allows the autonomic nervous system to fully transition into a deep, restorative parasympathetic state. Individuals consistently report waking up feeling deeply rested, devoid of classic morning palpitations, tachycardia, or heavy, breathless sensations in the chest. This protocol effectively counteracts the dawn phenomenon frequently seen in hypertensive patients, leading to a long-term state of systemic vitality. By the end of the 30-day cycle, the systemic protection against spontaneous coagulation is firmly established. The endothelial cells lining the arteries, no longer subjected to the relentless, grinding friction of sludged blood, are granted the biological reprieve necessary to heal microscopic lesions and restore their production of protective nitric oxide. The risk of the 4 a.m. ischemic event is drastically mitigated not by luck, but by the relentless daily application of physical fluid dynamics and mineral biochemistry. to view the ingestion of a simple glass of mineralized water before bed as a trivial habit is to profoundly underestimate the unforgiving physics of the human circulatory system. By introducing this precise volume of fluid and magnesium into your body 1 hour before the longest fasting period of the day, you are deploying a sophisticated, preventative pharmacological agent. You are utilizing the physical mechanics of plasma dilution to physically separate your blood cells, and you are deploying master minerals to chemically disarm your clotting mechanisms, ensuring that your cardiovascular system navigates the dangerous nocturnal hours with effortless fluidity and absolute safety, thereby securing your longevity and protecting your life against the silent, deadly threat of the morning surge.